most important sign is easy fatigability, pallor, weakness, irritability, loss of appetite. In many cases, it can develop a fever or give ill effect on the growth and development. In iron deficiency, it is seen that the cognitive growth of the child is becoming delayed with iron deficiency. So that is a most serious part of the iron deficiency because it significantly impairs the capacity of brain development. Generally, kids come to in front of us, we just look at their skin color. It looking pale, not a white. Many parents mistaking that their kids is very fair, this gora. Many times it is because of paleness or low hemoglobin. They look like some on fairer side. So we check the conjunctivis and tongue, lips, palm. So based on our experience and that finding regarding the color of the skin, and many times we compare our color of the skin with the child's color of the skin. So we probably believe that we have a normal hemoglobin so that we can differentiate that a child may have pale skin and which is give us suspicion about the anemia. And after that we do blood report, most commonly the CBC, where we see the hemoglobin and other blood cells. And based on this indices and parameter and based on the brief history about the especially diet history, you can find out child most probably have iron deficiency anemia, and then we can treat accordingly. It significantly affects the cognitive part of the development. Child has a low hemoglobin, he will get easy fatigability, he will have weakness, so that it significantly impair his participants in the day-to-day activity and being engaged with the other kids and school activities. So it will impair his exposure to development stimuli and which might lead to the consequences of the developmental delay. Every diet is a green vegetables, fruits are the most important iron source. We need to have in our regular diet. If we are eating a one meal, the two, if we divide the four part of our one meal, one part would be for protein, which may be dal or something. One part would be a carbohydrate, it could be a roti, chawal, or chapati, rice, etc. And two part are from the green vegetables and fibers, which gives us lots of micronutrients, including iron and fibers, which help us to getting all micronutrients. So, green vegetables and fruits are the most important source of the ions. And in detail, I'm not going to say which fruit is or which vegetable is a higher source of iron, because food is in India it is a wide country, and food is a very local, highly localized practice. So I think every locally culturally accepted food is a good iron sources. We need to go for it. And one most important thing, I request all the parents to refrain from giving excessive milk. Most commonly, we feel that parents are giving unnecessary large amount of milk than it is required to feed their child, because they feel that if child is not anything right and there, so at least we should give them milk so that they will grow. Yes, milk will satisfy their daily calorie need, but they won't give micronutrients like especially iron, and child will end up with the iron deficiency anemia. We have seen many cases where child is exclusively fed on the cow milk, at least 1 liter milk in a day, and parents will feel lots of proud about themselves that they are giving lots of milk to their kid and how the kid is growing. But in reality, the child has iron deficiency anemia, and in some extreme cases, we have to give blood transfusion also for this. So balanced diet with lots of green vegetable is a key. If you feel that the child is not eating enough and you might have difficulty with feeding your child, you can always ask the expert help. The pediatrician might prescribe you deworming medicine. Pediatrician might prescribe you the iron supplement syrup, and they will teach you how to feed your child. I think that is these three things most important. And again, I request all parents, don't give excessive milk to your kids. The recommended daily amount limit of the milk is up to 400 ml in a 24 hours. That's all. I think these are basic dietary modification will help parents to reduce the iron deficiency anemia. The treatment of iron deficiency anemia, I have already mentioned you. We see that the treatment will be depending on the how low hemoglobin is and how the symptomatic child is. If child has lots of symptoms, child is very sick, child is very difficulty with low hemoglobin, in that case we need to give blood transfusion. On the other side, if child have milder symptoms, mild to severe symptoms which are not that much serious, we might give iron injection, but which is very rare practice in India. In other mild to moderate cases, we need to give a higher doses of the iron supplement syrup. And in the mild cases, we do dietary modification, like I explained you, less milk, more green vegetables, deworming, and regular balanced diet, and follow with uh, supplement uh, supplements of iron syrup, which is in a maintenance dose. So, where these all measure, we can address the iron deficiency in it. So, I think we need to more focus on about the how to prevent the iron deficiency anemia, and is the only way we can prevent is with the proper practice of a balanced diet. That's all.